We're back with Dr. Tiffany Tyson, who is talking about the Empowerment Series. So, violence, bullying, and a low self-esteem is becoming more apparent because of the social sites. So, what can people do to deal with such online abuse?
Well, again, people need to really educate themselves about what sites they're actually going to. And as far as what parents know, again, know what their sites are for their teens, also know what type of friends their teens are hanging out with as well. And then also, if there are bullying that is noticed, you can actually block the bullies from your particular child that's watching the website. So again, educate yourself on what you're watching and then who has access to what you're watching.
Well, as we know, bullying is something people learn. People aren't born just learning to bully people. So where do you think most of this learning habits come from?
Well, sometimes bullying can come from home. Again, sometimes parents who grew up in a not so pleasant family environment, there may have been bullying going on in their family or alcohol or drug abuse, and sometimes it's passed down, and sometimes the parents may bully their children, or the older sibling may bully their younger sibling as well. And oftentimes people that are diagnosed or underdiagnosed with learning disabilities, they lack that self-confidence that they need to have those social interactions. And so sometimes they bully others to make themselves feel better or feel more confident when that's not actually what's occurring, and when they actually need help themselves to boost their self-esteem.
So how do you suggest dealing with bullying?
Well, that's twofold. You need to first look at the person that's doing the bullying. Again, like I said earlier, you need to kind of help them identify their self-worth or increase their self-esteem. And sometimes you can do that, again, by, if it's in the classroom setting, allowing them to do certain activities in the classroom to show them that they can, even if they have that learning disability, be able to accomplish things that their other classmates can. And again, once the child starts to feel that they are good at some particular thing that they can do, this will help boost their confidence and hopefully have them to be less, or have them not to bully others. And also you have to, for the person that's being bullied, they need to, again, identify their coping skills that they need to have as well. They need to tell others that they're being bullied. If they can't tell their teacher, maybe tell their counselor. There's also 1-800 line, stopbullying.gov, that they can go to as well if they feel like their voice is not being heard within their school system. But each school system should have a bullying policy put in place.
How do you tell or identify someone as being bullied?
Well, sometimes, again, bullies, they may be withdrawn, they may not want to participate in peer activities, and sometimes kids, if they're riding the bus, they really don't want to ride the bus to school because of fear that they're going to be bullied when they get on the bus. So sometimes they socially isolate themselves from others, and even sometimes you may see them have thoughts of suicide because the bullying has become so intense. So being able to identify those early signs of thoughts of suicide.
If the police or an adult figure will not help, how should someone handle the situation if you are dealing with bullying or domestic violence?
Again, if the police is not helping, again, if it depends on what setting it's in,
Right.
Again, if it's in the school setting, again, talking to that counselor, again, either calling those 1-800 lines such as domestic violence or Stop Bullying, the 1-800 service line. And like I said, they will also give you tips or some advice that you can utilize as well.
Okay. How is it possible to know if someone has a low self-esteem?
Again, it kind of goes back to, again, they may be withdrawn, they may not want to participate. Sometimes these individuals can't even take compliments very well because they're so used to being, oh, I'm fat, I'm ugly, I'm not pretty. So sometimes even it's hard to give them a compliment. They're very negative often about themselves.
How can you tell when someone is in an abusive domestic relationship? Are there signs?
And in the workbook, there will also be some tips related to that teens or young adults can also view. And sometimes in domestic relationships, you'll notice that the person or the abuser is often trying to be controlling of that person. They may tell them they may not want them to wear certain things or hang out with certain friends. And so they may try to control them in every aspect of their lives.
Right. Is there any topic that you have yet to address in the workbook? If so, what tips would you suggest?
I think for the next short series, I probably would like to touch on maybe suicide, because again, we do see suicide and the effects of bullying lead to suicide, and so I think I would like to talk about that next.
Exactly. What is DNL3?
DNL3 is Discover Nursing, Living, Learning, Leading Community. And this is actually a program within the nursing department that allows pre-nursing students to interact with nursing faculty, and they also get to interact with senior students to help them kind of bridge that gap in between learning more about nursing and what they'll be doing when they actually participate in the upper level nursing courses. And so throughout the year, we allow these students to participate in different activities, such as we have a couple of them that are participating in the PSA commercials, and so they actually gain points. And so each activity that they participate in, for instance, if they came to the audition, it was 10 points. If they were actually selected to play a role, it was 20 points. And so we encourage these students to maintain their GPA, and then if they're able to do that, usually if they are able to have at least a 3.5, it guarantees them acceptance into the BSN program.
Awesome, good. We're just about out of time. Are there any last words of encouragement for someone who may be in need or help?
Again, I encourage those individuals to reach out to someone, let them know what's going on. If they're being bullied or if they're having problems with a relationship that's gone bad or that's dysfunctional, whether it's their teacher, their counselor, someone at work, or even calling the hotline. Sometimes people don't want others to know. They feel embarrassed about issues that they're having, and that's why it's nice to have those 1-800 numbers where you can call, and it can be anonymous. But I encourage people to just reach out, tell someone.
When we come back from commercial break, we will be joined by Megan Reed and D'Angelo Scott to talk about the PSA they are currently making.